So Phillip is founder of Pando Health, a company building a grassroots integrated healthcare platform. Pando's connecting healthcare professionals in new and groundbreaking ways, driving down the cost of care and championing patients and patient care. Prior to founding Pando, Phillip was a 3-time founder, a programmer, and a university lecturer. Welcome to the Remote Startup Expo.
Oh, it's so good to be here, Joe, and thank you so much for the invitation.
My pleasure, my pleasure. Well, why don't you briefly introduce yourself? I know you have a video. I'm going to try to get that up and going while you just, in your own words, introduce yourself and Pando Health.
No, sure. So simply put, we enable doctors and nurses to connect and to communicate. We let them do it in real time through instant messaging. So we are a messaging platform, but what we really enable is the ability for a healthcare professional to make the right decision at the right time by providing instant access to their colleagues, no matter where they are. So we're mobile first, but we've recently started launching clients on desktop. And really, it's our mission to create the largest network in healthcare, first for clinicians and healthcare professionals, and then for patients.
Perfect. Well, I'm going to try to start this video and see if it works. I hope everyone saw that. Okay, Phillip, let's jump into Q&A. Can you hear me okay?
Yeah, and the good thing is, I think given our audience, I think we all know what a messaging platform looks like, right? I think what's powerful, and I think what's really transformational, is that what we've built is so far a 50,000 strong clinical network of doctors and nurses. And so really what that means is that if you have a question, any healthcare question, you can reach out to the foremost expert in that field immediately, and you can ask them questions as if they're standing right beside you. And I think the more you know about healthcare, I think the more it becomes clear that just having access to information and expertise like that is just transformational.
Absolutely. And I'm just curious, just taking this back to where you started, where did the insight come from, and what inspired you to found the company?
So yeah, as you said, I've started several companies prior to this one, and actually we had just closed a Series A at Good Lord when I actually met my now wife, who is a pediatrician. So actually, it's a love story. I was inspired by somebody who was a doctor. I'm an engineer, but the more I learned about it, and the more of an insight I got, it just felt like a problem that was too big and just too unsolved to ignore. So actually, I left my last startup and started this one.
Wow, interesting. That's exciting. I didn't get that background previously. That's wonderful. So one of the reasons I'm so glad that you're here is because I think you add a unique perspective to this whole remote work conversation, because you are so focused on one particular industry and one particular kind of like group of stakeholders in the healthcare system. My question for you is, what makes remote collaboration and communication different in the healthcare industry than in just the generalized tech community?
Yeah, it's a great question, actually, and so much of the answer really it was in my own disbelief, actually, when first exposed to the sector. But when I talk about healthcare, I really describe it as being complicated, dynamic, and highly agile, but it's also profoundly human. Healthcare interactions are ultimately built on trust. So when we give clinicians remote alternatives to the pathways and to the ways of working that in some cases they've been using for decades, it's not just about shifting information, it's also about imbuing trust in a new platform, because quite literally, and you don't always have the opportunity to say this without almost exaggeration, but quite literally, lives are on the line in healthcare. And I think that's really why, perhaps as a sector, it's been relatively cautious about adopting technology. So for us, a real challenge is being able to look at these problems and say, well, hey, we've seen how technology has transformed other industries, around the economy. But then being able to introduce that technology in a respectful way, in an appropriate way, and in a way which is ultimately safe.
Yeah, I mean, such a great point. And I remember, correct me if I'm wrong, but as humans, right? Like the alternative is in the healthcare system. The alternative is the pager system, of course, which is more secure. But as we all started to get smartphones, people were using workarounds because they were using WhatsApp because it was just more convenient, and that introduced all these like risks and whatnot. So I think what you're doing makes a lot of sense. Wanted to ask you, we met over a year ago, but wanted to ask you, same question I'm asking a number of founders, is just where you were pre-COVID and now where you are post-COVID. What's been the response from the market given the new world we all live in?
Sure, absolutely. So we are a remote healthcare communication platform. So in a sense, if we in this particular environment, then we have to think very carefully about what we're doing. So we've been fortunate in that there's been quite a lot of demand for what we do. That's come with its own challenges. So phenomenal growth. We're 300-400% most days on where we were 6 weeks ago, and we're welcoming 1,000 doctors a day to the platform. But it's also come with a lot of challenges around doing what we do and doing it well. It's always nice to get demand. Like, it's one of those luxury problems that startups, almost hope to have to deal with. But again, getting back to, these duties of care and responsibility about what we do, it's really scary launching features or changes to the platform, especially to a user group which is 24/7. And doing it a lot faster than you would traditionally do it. So for us, we've been incredibly busy. I think for the team, it's been good in the sense that, they feel very relevant. They've got a mission, and they can see how that mission is directly helping something which is at the top of a lot of people's anxiety list. So I think for the team, it's really helped them deal with this changing way of working. But it's been tough because we've had to kind of do what we do, but do it a lot faster. I'd say also as well, it's good to get signal, right? It's good to get like high contrast on signal, because especially, we're about, we're nearly 3 years old now as a company, which is, sort of old enough, I think, in startup years. And what we find when things are extraordinary as they are, is that the things that are working are really working, and the things that aren't working, people kind of ignore. And so that's really helped us get clarity and focus from a product perspective.
Oh, interesting. And what do you think the kind of post-COVID world is going to look like in the context of healthcare, collaboration, remote work? And how do you see Pando Health playing a role, like kind of in the longer term?
No, for sure. So it's a bit of a cliche now, certainly in UK health tech, but we say there's been more innovation, more technology adoption in the last 4 weeks than there has in the last 4 years. But it is genuinely not an exaggeration. Right. I think what it's shown is what's possible, right? So it's shown, I think, that the positives and the advantages to some of the technologies, not just that we're building, but that our colleagues in the wider health tech space are building, that the positives are really quite profound. Okay, and the negatives actually aren't as scary as people thought they were going to be. I suppose like one lens I sometimes look at it through is, this is a social experiment that nobody would ever have the opportunity to run, but it's forced every sector to challenge the way it thinks and to just do what it does, but with very different rules and very different tools. And it's given everyone permission and a license to just be bolder, to be more courageous and more experimental than they've ever been before. And in healthcare, that's a really good thing, because you mentioned the bleep, the radio pager. That's 50-year-old technology. Okay, it is an old tool, but it is still a tool which is used because people are scared of change in healthcare. But because of coronavirus, they've been forced to change. I think it's not an exaggeration to say that we'll see healthcare 2.0 after this.
Wow, really well put, and kind of an eloquent way of saying that. I want to transition to some audience Q&A, and I've got one here from Brian Goldbeck. I'm not sure if you can see it, but it's, are you looking to integrate your platforms with major EHR or PM systems out there? And then listing a few like Nextech, Advanced. Talk a little bit about that.
Yeah, there were two things we built this business on in the early days. One was that we're bottoms up, because if we have to work with the hospitals, unfortunately, we would have already have failed. Not because they don't want to innovate, just because of the speed at which large organizations move. So we were always bottom up. And the other one was that actually, you mentioned WhatsApp too. Well, that's actually used by still 90% plus of clinicians around the world in healthcare. Now, WhatsApp isn't integrated with anything, but it answers a profound latent need. And so we took the position that, well, if a platform like WhatsApp can be so used and not integrated, then we can first replace that. And then when we build a network, when we build leverage, we'll start to talk about integration. So, actually, in the early stages of the business, we would have said no to integration, but it's now a conversation which we're starting to hear a lot more about. But we're fortunate to be essentially a cloud generation business. So, essentially building APIs into what we do that make us an interoperable platform is something that we've built into our DNA. But again, it's about still moving fast, and it's about only integrating where it makes sense. But I think just as a wider point, data in healthcare is siloed. It doesn't just exist on WhatsApp channels, and you might consider it to be sort of incumbent electronic patient records. It exists in filing cabinets and bits of paper. And healthcare, the direction of travel must be to break those silos down and to enable the interoperability of data.
Got it. So in other words, you're not relying on any of those systems, but you're open and planning to potentially connect and integrate with.
Exactly. It's entirely greenfield still. Yeah. I think until we have a platform that essentially using WhatsApp would be a laughable alternative. I think we've still got a lot of work to do as a standalone solution.
Excellent. For just one more, I see Greg McNeil put in a question. Hey, Greg, how are you? Phillip, seeing how you're in a heavily regulated space, how many personnel do you have specifically dedicated to dealing with regulations and interacting with agencies?
Yeah, it's a great question. So actually last week, when we were doing some of the prep talk of this, Joe, we got approved by NHSX. Now, NHS, of course, is the UK healthcare system. And the NHSX is their digital department, and we're now actually the only officially authenticated COVID messaging platform in the UK, which is really fantastic. So in a sense, we have an internal team, and it's something which we've always had. We're a team of 32, which is small, but we have a number of people dedicated to this. But in a sense, every hospital we work with and the NHS itself, they police what we do, and they ensure that we are up to the mark. So we couldn't be non-compliant, even if we tried. There's an enormous support network here, and it's a good place to be in the UK actually, because we can work very closely with the NHS and the digital teams there.
Fantastic. Well, I think with Sandra here, that means we're just about out of time. But Phillip, want to say thank you so much for being here. I think you're adding a lot to this conversation in a way that most people in the room probably hadn't really thought about before, and contributing a lot to our community. So I appreciate it.
And Joe, thank you so much for this event. Truly fantastic. I'll be spreading the word. Thank you so much.
Appreciate it.